Hi, I'm Matt Ward. I'm a partner here at Anthony Collins and lead the work in the social care sector. I'm joined by Martin Green, OBE of Care England. Martin, thank you so much for taking the time to speak with us today. Could you just introduce yourself and say a little bit about what Care England does?
I'm Martin Green. I'm the Chief Executive of Care England, and we're the largest representative body for care providers in the UK. Our members provide services for older people, many of whom have comorbidities and dementia. We also have significant numbers of services for people with learning disabilities and people with brain injuries and mental health issues.
Thanks for that, Martin. From the very start of the pandemic, Care England were front and centre, championing the needs of the sector, influencing positive change in government guidance and constantly in the news, highlighting what needed to be done. How important was it for Care England to have legal support from Anthony Collins solicitors through this period?
It was very important for us because the agenda was moving extremely quickly. And one of the things that was happening was that people, in their haste to do things, were often doing things which were not necessarily compliant with the law. What having Anthony Collins colleagues in meetings helped us in, it identified what the legal position was. And when we knew what the legal position was, we could then craft solutions that were not only going to deliver an outcome for the service user and the resident, but they were also going to be within the context of the law.
Thanks, Martin. That's really good to hear. So how did the support provided by Anthony Collins solicitors help you influence policy and help you support your members as they looked after some of the most vulnerable people in society?
One of the things that you did was help us with some of the rights-based approaches so that when we were coming forward with our solutions, we understood what the rights of the resident and their families were, and we then crafted solutions that were absolutely in keeping with those rights.
That's great. So could you give us an example of how a resident at one of your members' homes was positively affected through the support we provided to you?
Some of the advice you gave us about how we maintained people's human rights while at the same time protecting them really helped us to craft solutions which were very clear about how you had to maintain people's contact with their families and loved ones while at the same time maintaining their safety. So all those things really were tangible ways in which your involvement and your advice helped people who were both living in care services and also providing them.
Thank you, Martin. And finally, what was the one piece of advice that made the most difference to you and your members?
I think the issues around the Human Rights Act and where that positioned itself in relation to what we did maintaining residents' human rights. I think there was also some very useful information given about guidance around PPE, which was another challenge that we had at the start of the pandemic. And I guess those two stand out for me as really critical moments when you gave us a very clear and very definitive legal position. And that enabled us to craft a solution that was within the law, but delivered what both the service user and the care provider needed.
Martin, it's been really good to see you today. Thank you so much for your time, and just want to wish you best of luck for all you carry on doing, supporting your members through the pandemic and throughout 2021.
Thanks, Matt, and thank you to you and all your colleagues for the tremendous help you've given us.